Hi, good evening. Wow. So exciting to see so many people here to join us tonight. Welcome. My name is Dr. Sarah Odor, and I'm the Research Director of the Pediatric Neuropsychiatry and Immunology Program at Massachusetts General Hospital, Harvard Medical School, otherwise known to many of you as the PANDAS program. I am a clinical psychologist specializing in assessment and treatment for children with anxiety. I'm a huge believer in the team approach to solving problems. So with that in mind, let me tell you about our team and what our mission is. Our program is composed of clinicians and researchers committed to helping children and families with PANDAS, a condition you'll hear more about shortly. To help me moderate this webinar and tell you more about our program, I have with me another member of our team, Dr. Safran Humayun, child psychiatrist and research fellow here at MGH Harvard Medical School.
So hello everyone, just wanted to tell you a bit more about our program. So we've evaluated and treated more than 1,000 patients since we started, and in a year we see approximately 150 new patients, 500 follow-ups, and on top of that we also get contacted by about 300 families a year also seeking care. So we're one of the largest clinical practices specialising in PANDAS in the country, and the largest by patient volume on the East Coast. But unfortunately, we still don't have the capacity to treat everyone seeking care. So if I've been fortunate enough to meet you in clinic already, you'll know that Sarah and I love data, and our patients are part of our team to understand this condition and better inform treatment. And we really pride ourselves on using evidence-based care. And if the medical evidence doesn't exist yet, then we want to use research to try and find that evidence.
And so as Safran mentioned, we have a vibrant research program to learn more about how to treat our patients and inform treatments to be used globally. We have brain studies, drug trials, and even nationwide surveys to better understand the problems children and families dealing with this condition are facing. Some of you may have participated in those efforts by donating your time or money, and I want to tell you a huge thank you. None of this is possible without you. And so I often get the question from our patients and families, so what have you found? And so tonight we're fortunate to have the director of our program, Dr. Kyle Williams, with us to give us an update on the state of the field in PANDAS and PANS.
So we're going to have a question and answer session later on, and we've already received a huge volume of pre-submitted questions, so thank you ever so much for that. We really appreciate it. And if you have questions while you're listening, then please use the Q&A chat function and send us your questions anonymously. We have to apologise in advance that we probably won't be able to get to every question, but we'll do our best to try and answer as many questions as we can. And as I mentioned already, we love data, so please fill out our survey when you're done listening to the webinar. And there's going to be a link to the survey as well as our website and ways to support our programme that will be in the chat box. We'll leave it up at the end of the presentation as well. So without further ado, we're going to start recording, and I'd like to hand over to Dr. Williams.
Great. All right. Thank you so much, Sarah and Safran. And thank you for making the time to log into this. We felt like this year has been so unique and challenging that we really wanted to have some outreach and have some way to talk about still what we're doing and keep people connected to our program, and to have everyone understand what a team effort this is, and how fortunate we are to have this team, both teaming with the folks at Mass General, but also with our patients and our families, and to talk about how excited we are about what we've found recently and what we're going to extend out into the future here. I am going to share my screen, or maybe it's being shared right now. Let me just make sure. Whoop. Okay. Great. I hope that this share screen is working. You'd think all the time that I've spent on Zoom the last year here, it would be second nature. We're still getting there. So I just wanted to, you had an introduction to Sarah and Saffron, who are just absolutely integral to everything that we're doing right now. And some of you maybe have been fortunate enough to meet the two of them in clinic or in our research studies. The other two people that are incredibly important to our program and part of our program are Dr. Mark Pasternak, the Chief of Infectious Disease, Pediatric Infectious Disease at Mass General, Dr. Dan Geller, who founded the Pediatric OCD and Tic Disorder Program and helps us out integrally with all of the research that we do in the program. So the two of them are very much a part of this program as well, and really important to what we do as well. So I just wanted to acknowledge the two of them up front. And to state basically that today, so we'll talk about PANDAS and PANS. Most of you likely do not need an introduction to what these disorders are, but just very briefly, I'll say that both of these disorders are disorders of rapid onset obsessive compulsive symptoms or tic disorder symptoms following an infection. PANDAS is specific to a streptococcal infection. PANS is open to any other type of infection. So it can be a mycoplasma pneumonia infection. It can be a Lyme infection, something else like that. So when we are being specific, PANDAS is streptococcal related. Lyme and other infections are more PANS related. And with a word, I just wanted to say with a word to COVID, we are getting a lot of questions right now about whether or not COVID affects kids with PANS or PANDAS. The answer is simply that we don't know. We have not, thankfully, we haven't had many people in our program. I'm sorry, my son is banging on the window right now. This is the beauty of working from home. We have not had many kids have COVID in our program. And so we don't know that it really affects things specifically or not. And if we find out more, we're going to send that out to everybody. But in the meantime, absolutely, I would say that everybody, please get the vaccine when it comes out. And hopefully everybody has been healthy with it. I know it's been a challenging time. Hold on one moment, please. Sorry about that. I have a 5-year-old who's very active coming in at the wrong moment. So what are the current challenges that we have right now? So we really have challenges across the board. So diagnosis is a major challenge for PANS and PANDAS because we just do not know how accurate our diagnoses are. Treatment is a major difficulty as well because we have very few evidence-based research studies right now that we've done that actually show, what a certain treatment has an effect on either OCD symptoms or tic symptoms. And finally, we still really, and this is frustrating for everybody, this diagnosis lacks the credibility and the recognition that we think it should have at this point, right? So we have a lot of people who are, having to find different doctors or having to travel for their care. They're afraid to discuss these things with their physicians because they feel like it's not going to be received well. And regardless of sort of the level of evidence for disorder or not, I think we always have to feel comfortable talking with our physicians about what's happening. And so this should not be something where people feel afraid to bring it up at the doctor's office, right? And so what we really aim to do is through continuing our research on diagnosis and treatment, we are going to hopefully bring the world around to where we are, which is that this is a credible, recognizable, diagnosable disorder that requires treatment. And what are the ramifications of not doing so, or how do our kids sort of evolve or present to care? Well, one of them is that about 1/3 of them are presenting to the ER right now at the emergency department, which is astonishing for a psychiatric disorder in children. It's very high, but routinely in clinic we hear that that people have gone to the emergency department first, or that there was such a sudden change in a child's symptoms that they had to actually go to the emergency department because they were so concerned that something acutely neurological was going on. So this is really something that it reflects the level of difficulty that it is for the kids and the parents when this disorder happens. And then the mean out-of-pocket cost for treatment. $12,000 for treatment for PANS and PANDAS that we saw. So this is the result of a web-based study that we did with help from the PANDAS network, where we put an internet questionnaire out there, and this was done by Dr. Odor, where we asked a number of different questions about how much money have you spent, how much time have you traveled to get care, how many physicians have you spoken to. And we're trying to get sort of a better sense of what is it like for parents and families when this disorder starts. Aside from just our clinic, what are the sort of the hard numbers that we can represent to different physicians about how often this is happening. So this study will have hopefully published in the next few months, but it's a really extensive study looking at the kind of the family factors of having a child with PANDAS, as well as the effect that it has on parental relationships, on marriages, on just general health. So we found some really interesting things, and we'll be publishing this soon. The other thing that we really are focused on in our program is looking at how we improve our diagnostic accuracy, right? And this is, it's hard for me to stress how, this is the lifeblood. This is so important for what we do, because really, when we look at it, OCD affects an astonishing amount of the population, a really high amount of the population. And 2%, which is actually quite a bit. And that's worldwide. So we still have no idea what causes OCD, unfortunately. So if it's genetic, if there are other factors, and we have then, made this hypothesis that PANDAS is a subset of OCD, right? It's an inflammatory subset of obsessive compulsive disorder. But the question is, how do we actually reliably find that group, right? And right now we do it by diagnosis, just based by our clinical acumen, basically, or our clinical diagnostic criteria. And the difficulty with that is that we can interpret those things in so many different ways. Or, someone will come to me and say, I think I had the onset of PANDAS 8 years ago. And we have a really hard time then knowing, okay, if we go back 8 years, is this diagnosis, can we still make it accurately, or is it inaccurate? So the diagnosis for us really is so paramount to what we want to do, both in research and in treatment, that we really need to find a way to increase our accuracy and have a sort of a gold standard to check our work other than just a clinical diagnosis. Because someone comes to me, I could say, absolutely, you've got PANDAS. They could go to someone else and they say, absolutely not, they don't have PANDAS. At the end of the day, we really don't know who is right. And we need to rectify that somehow. So the difference here really is that this matters because, for decades, for hundreds of years, people have been diagnosed with schizophrenia or psychosis, right? And we didn't really understand until the last 10 or 20 years that some causes, some syndromes that look a lot like schizophrenia or psychosis are actually caused by an autoimmune antibody. And this is really best typified or explained on Brain on Fire in this great book by Susanna Cahalan. I think it's on Netflix now too. But she had NMDA receptor encephalitis, but it looked like she had schizophrenia or psychosis. And there are other symptoms as well. But really, the consequences of getting this diagnosis wrong are huge, because if we use psychiatric medication, if we use antipsychotic medication, patients with an autoimmune condition don't improve. They don't get better. In fact, they get worse. So we miss this chance to potentially save their lives by using the correct medication for them, which is an anti-inflammatory or autoimmune treatment, as opposed to psychiatric medication. And I want to be specific in saying that there are certainly reasons for people to be on psychiatric medications. And I'm a child psychiatrist, so I believe these medications are vital to some people's lives. But we want to use them when they are appropriate and needed. And if the diagnosis is actually something that is not going to be improved by psychiatric medication, we also want to make sure that we get that right. And so the question really is, are we dealing with a similar situation in kids with PANS and PANDAS? So how do we know if we have the correct diagnosis, and then what implications does this have for treatment? And most importantly, if we are wrong, and let's say we're wrong 30% of the time, right? Which maybe is generous, or I don't know, maybe it's, who knows? How does that affect our research studies? So if I'm doing a research study of IVIG, if I'm doing a research study of SSRIs, et cetera, if I'm getting the diagnosis wrong and then looking to see how it worked in the end, how is that actually going to affect my study? And the answer is that it's probably going to ruin it, to be honest, if we do not get the diagnosis right, because I don't expect IVIG to improve someone who doesn't have PANS or PANDAS, who has, regular OCD. And I don't mean regular in that it's not serious, but non-PANDAS OCD. I would not expect IVIG to improve that population. So if they are enrolled in my research trial because I got the diagnosis wrong, then my research trial from the get-go is in trouble. So this is really why it's so important that we find a better way to do this, both for research, and then if we think about all of our patient studies, all of our studies on looking at how effective a medication is or an intervention is, it's all based on a research study as well, right? So it all comes back to our ability to separate out these two populations. So how are we going to do that? So the first study that we have going right now to really help us out is to look at neuroimaging, right? So we are doing an MRI study right now of kids with PANDAS, and really the basic question for this is, do the brains of kids with PANDAS, do they look different from kids with OCD, or do they look different from healthy controls? So can we, quote unquote, put a kid in a scanner, in an MRI scanner, which is, it's scary. It makes a loud noise, but it thankfully does not hurt you at all. There's no radiation. There's nothing, there's nothing, you are not worse off in any way for having an MRI done, as long as it's not, again, we make it comfortable for you and it's you're not claustrophobic. So can we use this technique in kids with PANS and PANDAS to say, okay, look, the brain of kids with PANDAS looks this way, the brain of kids with OCD looks another, and we can use this to help to separate these populations out. And the difficulty right now is that really we have a hard time identifying inflammation in the brain through an MRI. And the reasons for this are technical. But usually when we're looking at an inflammatory process, either it has to be huge, it has to be incredibly affecting the brain to be picked up on MRI, or we have to use a different type of imaging that uses radiation, and we don't want to do that in kids. So what we really have been focused on is an MRI trial to look to say, okay, this is a subtle marker of inflammation that we see in an area that we think is involved in PANDAS. And the areas here that are lighting up on this MRI are a few of the nuclei of the basal ganglia. And the basal ganglia is something that we really feel like is incredibly involved in not only obsessive compulsive disorder, but by extension in PANS and PANDAS as well. And so we are looking at some new techniques and some new therapies, new methodologies is a better way to say it, to look for subtle measures of inflammation or edema or other things. Again, they don't hurt at all, they're safe to be done, but they're not part of the standard sort of MRI sequence and suite that most clinical places use right now. We're able to do this because of the Martino Center, which is a huge neuroimaging center that really has just an unbelievable amount of expertise and experience. And so we're scanning kids down to age 6 right now. Between ages 6 and 16 are the core of our imaging study. And at the end of this, our hope is that we can answer, maybe not definitively, but we can get further down the road to say, can we actually determine the diagnosis through MRI? Could we put this MRI in front of someone who did not know the clinical history of this child, and they could say, this person has PANDAS versus this person has OCD? The other thing that we really are excited about is trying to find out if we can say, okay, it looks like when this child is ill, when they're early on the onset of their disorder, this part of their brain looks different. And then we treated them, they're better. And then we scan them again, and this part of their brain looks improved or looks better. So we are very excited about this technology right now. It's been a long time to set up. And this is, again, being run by Dr. Odor and Dr. Humayun. But we are just sort of getting some answers now about what we found. So we've scanned over 30 kids. This is kids with PANDAS and healthy controls. And we are starting to see a difference now between PANDAS kids and healthy controls. We need more kids with non-PANDAS and PANS OCD in here. But we are starting to see this difference between these populations emerge. And this, I should say too, this was originally funded and is continued to be funded by the PANDAS network, and then was funded last year by the International Obsessive Compulsive Disorder Foundation. So we're getting interest, I think, across the board for starting to look at these studies. And the goal here then is that we will find some sequence or technique that we're able to roll out, to other groups and to other studies, to other places around the world, to start to use this to differentiate between these populations. The last thing too that's of interest is that we found that the severity of someone's OCD symptoms is actually related to the amount of tissue disruption that we're seeing right now. And again, this is very subtle tissue disruption, and it's in specific areas in the basal ganglia, but it seems to track with how sick the kids are at the time of scanning. So stay tuned here. We hope to have, a kind of a preliminary analysis of this out within the next year. But really, the MRI is great, but we used a very specialized MRI, a type of scanner at MGH, the Martino Center, and we're having these things read by people that, are very, very kind of uniquely experienced in doing these things. So it's not the kind of thing that, unfortunately, that we're going to be able to say it's going to be across, available across the country in the next 10 years. But a blood test could be, right? And the blood test is really sort of a holy grail kind of the PANS and PANDAS diagnosis, the idea that we could just collect a sample at the beginning and have some real accuracy of whether or not someone has this condition versus obsessive compulsive disorder. And you know what, I'll talk in the question and answer session about the Cunningham panel. Madeline Cunningham is just a wonderful researcher and a very good friend of mine. And we're still trying to determine how the level of accuracy for that test, for differentiating between PANDAS and PANS and OCD. And again, that's really what we want to do, because the vast majority of kids who come to see me, they have OCD or they have tic disorders. And what we're trying to do is determine between PANDAS or OCD. So it's not as much PANDAS and healthy control. For us to be really interested and to really move this field forward for us, it's got to be a differentiator between PANDAS and OCD, or PANS and OCD. So that's why the idea of finding, this inflammatory sequence or an autoimmune antibody is really, really important. And so I'm very happy to be able to discuss here the results. So this is actually the results of two to three experiments that have been going since probably for 10 years, actually. This is the result of our first IVIG trial, or the IVIG trial that we did in combination. This was when I was at Yale in combination with the National Institute of Mental Health, where we were taking blood samples from kids, and then those kids with PANDAS were being treated with IVIG. And then we're looking at them, down the road to say, did they improve from IVIG? Did they not improve from IVIG? And many people probably have seen that study out there. Ultimately, we did not find in the blinded portion that IVIG beat placebo. There are probably a lot of reasons for that I'm happy to talk about later in the question and answer as well. But what we did is we took the blood samples from those kids and we said, is there an autoimmune antibody here that seems to be responsible for their symptoms, or is at least involved in recognizing any brain tissue? And first we did this in mice, and then later it was done in postmortem human brain. And so my involvement in this, actually, this initially was my dissertation when I was at Yale, and then left to come to Mass General. So I was involved in the initial part here of starting the study up, and then obtaining the samples. And then after that, Dr. Chris Pittenger, Luciana Frick, and Jean Zhu, a postdoc in his lab, really moved this far afield forward to actually determine that there was an autoimmune antibody. There was an antibody that not only bound mouse brain, but it bound human brain, and it bound the caudate and the putamen. So this is a slice here of postmortem human brain. And essentially what was done is we overlay human serum onto that postmortem brain, and we look to see, do any antibodies glom on? And do they glom on to the same thing from different samples? Can we identify the neuron that they're glommed on to? Can we find anything that is a common thread between these patients with PANDAS in regards to an autoimmune antibody? And so the answer was yes. And this was in both in 2 studies here in 2017, and then one we just published in the American Journal of Psychiatry in 2020. So these investigators, Chris Pittenger and his lab, they found basically that the kids with PANDAS had antibodies to a very specific neuron in the basal ganglia, which is really interesting because this neuron is actually, we know, is also abnormal in Tourette syndrome. So a related condition has a lot of difficulty with the same type of neuron, and we're actually finding an antibody to that neuron in the blood of kids with PANDAS. We found they found minimal binding in healthy controls. And interestingly, following IVIG, this antibody decreases, the percentage decreases of binding from the antibody following treatment with IVIG, and that decrease correlates with a decrease in OCD severity in these kids. So just to show you another picture here, this is not minus serum and then positive serum. This is also human brain. CHAT is the acronym for the neuron. And this is actually 2 different microscope experiments looking to see, are these things binding to the same image here? So when, it's very technical, but when you see green and red together, it makes yellow, and that means basically that you have binding in both these images. So what this means is that this here binding, this binding right here is from the antibody from a PANDAS patient, from that's actually in their serum. So this really represents the beginning of one of, I think, the most profound, important breakthroughs in PANDAS, to be honest. Because if we can just do a blood test to determine who needs what treatment and what treatments work best, we have moved this field forward. Not me personally, but we as a group have moved this field forward. It just leaps and bounds, right? And we can stop having this conversation, this argument about whether this is real or whether this is diagnosable or what things make it better. And so that is kind of underscores how excited we are about this. And so right now, this work is incredibly technical. It takes us essentially screening kids, right? Getting their blood. That's not terribly technical, but then it has to be overlaid right now on a mouse brain slice, and then it has to be evaluated under a microscope. So that is not a high throughput technique. So what Chris and his lab what they're doing now is trying to find a way to be more specific about what this antibody recognizes, and then also to move this forward in a way that we could actually get to a point where it's a common or a more standard blood test. I think we get a lot of questions about this saying, okay, can I go get that right now? And I wish that we could. With both of these things right now, both the MRI techniques and the blood test that we're doing right now, I think it's really exciting. It's going to be very important. Right now, it's really not ready for prime time, which is disheartening. And I know it's frustrating for everybody, but we are going to get there. And we're going to get there, it's not going to be another 20 years. It's going to be much faster. And once we do, I think the next 20 years are going to be it's still going to be difficult to have this disorder. It's still going to be difficult for families but if we can imagine not having to fight about whether this exists or not, or whether the treatment, should be covered by insurance, et cetera, if those fights go away, we're in a much, much better spot. So a few more things that I really want to underscore and talk about too, that we've done both at Mass General and we've done in conjunction with some other folks. So Molly Coleman is the head of the LEAP service, which is the neuropsychology testing service at Mass General. And she did an analysis of 27 PANDAS patients that were patients from our clinic, and did a full neuropsychological battery on them. And what the neuropsych testing does is looks at memory, executive functioning, things like that. So it's a technical way, but it's a very objective way to look at some of the things that we already know from looking at these kids, like they're hyperactive, they're having difficulty with emotional regulation. We can say those things, and it's helpful to be able to have a common language to say those things, But for the, for school purposes or for purposes of research, it's incredibly important that we have an objective way to rank and sort of and look at the severity of these different difficulties. And that's what neuropsych testing does. So this is just about to come out in the next week to 2 weeks, but not surprisingly, but again, in a very significant fashion, she showed that kids with PANDAS have very marked ADHD related symptoms. So a lot of difficulty with inattention, with processing speed. It looks like some of the cardinal or core features of ADHD, but we're not actually sure if it's ADHD because it's come on suddenly in these kids. So it could be, again, it could be related to ADHD, or it could be related to some other type of cognitive process that we don't understand right now. But the difference was really marked in the kids with PANDAS. And the other thing too that we are very interested in and will continue, to look at in the future is motor precision and graphomotor control. So she and others in our group, Sarah Odor is looking at this as well. We're really interested in handwriting and graphomotor precision and control. And we're looking to try to see, does that correlate? Does that track with how bad someone's OCD is? When they first come and see us and their handwriting is terrible, if they improve in the next 2 years, does that improvement track with their OCD symptoms? Can we actually use fine motor control as a marker, as a more objective marker for how bad someone's PANDAS symptoms are? So that's where we hope to go with this. But the first step really was showing that there was a difference, and also showing that it is worthwhile, and I would probably argue necessary, really, to do neuropsych workups in kids with PANDAS. It's also very helpful, can be very helpful for integration with school and for looking at different services or things that are needed for school. The other thing that we published in collaboration that's just come out here in the last couple weeks is looking at immune deficiency. So if you have been in clinic with me, you probably heard me talk about the need or the necessity for testing immunoglobulins, because we in our PANDAS program, we're starting to see more kids with immune deficiencies that we felt like were pretty significant. And we thought that not only was it possibly related to their psychiatric or behavioral conditions, but we thought that if you had an immune deficiency, you were getting sick more often, and that sickness was driving some of the difficulties that you were having. So some of the obsessive compulsive symptoms, some of this other behavioral depression, things like that, we thought was being driven by repetitive infections that for some kids was related to an immune deficiency. So I had the good fortune of meeting some folks from the Karolinska Institute in Toronto a couple of years ago. This really amazing scientist, David Mateish-Coles. And I was able to convince him, I didn't take much convincing, he's very interested in all this stuff, but they have an ability in Sweden at the Karolinska Institute and Sweden in general. So they have a national registry, and they can basically anonymously look at their entire population and try to find out if 2 different disorders or 3 different disorders are correlated with each other. So we could say, if you have an immune deficiency, are you more likely to have a psychiatric or behavioral condition? And we're able to ask that across 17 million people, basically in the course of a year, through getting their registries. And so interestingly, what we found was that you are about twice as likely to have any psychiatric condition if you have an immune deficiency. But that risk was not uniformly distributed across all different psychiatric disorders. You are much more likely to have autism if you have an immune deficiency. The next most likely thing was an eating disorder. The third most likely was OCD. So not a huge surprise to those of us who've sort of been in this realm for a while, because we see, mixtures of all 3 of those things, I think, in not in all PANDAS kids, but in some. And so we are trying to understand now, okay, why are these things seemingly linked? Is there a direct link? It could be random chance, could be coincidence. But the more that I do this work, I think that there's actually something there. And so this is kind of the beginning right now of us understanding what to do next, and whether these things are linked. And the other thing I should say too is that we also found that there was an increased risk of suicidality in those who had an immune deficiency. And that's also something else that we need to really follow up on. So this was published in July in the American Journal of Psychiatry. And so we're really excited about this as well. So stay tuned for that. So again, this is the first paper that's out. We have a number of other things that we're going to continue to do with interest in this segment. So what's next? So really, so we've talked today about what we are doing as far as diagnosis and what we're trying to do to try to help out and to improve our diagnostic accuracy. What we're doing in the clinic right now really is trying to track all of the symptoms. And I know this is kind of sounds strange or is laborious, but we try to make it as easy as possible and easy on the patient and the family, not easy on our staff. Unfortunately, Sarah Odor and Saffron have spent, I don't even know how many countless hours setting up the system. But now we have a way basically where if we're seeing you in clinic, we're going to ask you each time like, hey, how are the eating disorder symptoms? Or how are the tic symptoms? How are your OCD symptoms now? And it is a pain to be asked those questions over and over again. But what it allows us to do is say, okay, it looks like we started this anti-inflammatory treatment for you here. And this is how things changed in June, August, October, right? Oh, you had an infection, or we saw a seasonal pattern in 30% of our patients. And that seasonal pattern of increase in their OCD symptoms happens to be around, the fall, winter months of increased infections or even back to school periods. So this tool will really allow us to start to, learn from all the patients that we see in clinic. So not learn individually, but learn kind of en masse to say, okay, this is the collective sort of data that we're getting. And we're understanding that 50% of our patients respond to anti-inflammatories, or, the average length of a flare or a difficult symptom after an infection is 8 weeks for 90% of our patients. This is how we start to lay the groundwork for those kind of questions. And it's really something that's only possible if we have a high throughput of patients, but we also are organized and have the ability to do that. And so we always had a high throughput. We always had a lot of patients coming in. And now we actually have the infrastructure to start to tackle some of these things. So we're really excited about this as well. The next thing really that's on the radar for us, I should say here, are clinical trials. So we try to, and maybe hopefully I've given you kind of some sense of this too. We try to be in both our research and our clinic and our research to have a pretty broad area of interest, right? So, I started out today talking about Sarah's analysis of kind of family factors of kids with PANDAS and how it's affecting the families. And then we actually went to a very specific sort of MRI techniques for inflammation, because again, we think it's going to be very helpful for the disorder if we show inflammation. And then to antibody testing, and then to, again, back to neuropsych profile. So we try to really look, we only look at one thing, PANS and PANDAS, essentially, but we try to look at it from every angle as we possibly can, because I think that's the only way that we're really going to start to understand the full scope of this disorder. So the next thing that really we are incorporating into our research paradigm is clinical trials. So we have a clinical trial that just started to enroll now of treating with anti-inflammatory medication, an oral medication, anti-inflammatory for kids with PANDAS. And we can't talk about it yet, but we hope that there's another clinical trial that we are starting the next year or 2 years. So we anticipate that that's really going to be, again, a mainstay of what we do from here on out. We have a really exciting imaging trial that we just started too. It's actually in adults. It's not adults with PANDAS yet, because again, the majority of adults who we see who have PANDAS, their onset was years earlier. So we don't have that many adults with onset within the last 6 months. So what we're doing in this other imaging trial is looking at obsessive compulsive disorder, and we're looking to see if adults with obsessive compulsive disorder actually have a higher rate of brain inflammation. And we can use a different technique to do that in adults. We can use a PET scan, which we typically don't do in children. So we're really excited about that study too. So the other thing that we are moving into, both in our MRI studies and in clinic as well, is so it's some inflammatory analyses. So we'll be collecting blood, looking at the level of inflammatory cytokines, or other types, again, looking for the autoimmune antibodies. So we're gonna go back kind of from, macro to micro scale, again, of looking at the changes in blood that we think are associated with PANS and PANDAS. And we're going to do that finally, and really with collaboration with a lot of folks. So we're collaborating with, I continue to collaborate with Yale, with my old laboratory from Yale. We have a very strong, and I'm sorry I didn't have time today to talk about these things as well, but Stanford, as I'm sure many of you know, is just an amazing PANS and PANDAS program. And Jenny Frankovich, we collaborate with them quite a bit. And on a sort of, we don't integrate our studies together yet, but we're getting there. And they do really an amazing job. So we are going to continue to work with Yale, with Stanford. We have a collaboration with Ratan Agaliu at Columbia that we hope to be starting soon. And then University of Arizona too is starting or not starting, they've had a PANDAS program for a number of years, and we're starting to integrate more with them. So really, we've got a lot that's coming down. And I think that it's time, right? I mean, we're 20 years into this diagnosis now, and it's hard to argue that things have changed all that much for people who have been struggling with this. They're still having a lot of the same difficulties that they had when this diagnosis really was first kind of coined or came out. So it's time to do something about this. And what's I think is so crucial is that we have the technology now, we have the ability to do it. And there's no reason not to. So that is what the next, I think, 5 to 10 years have in store for us. I think it's going to look very different than it does now, and we hope it does, because it should. So how do we get involved, or how can people get involved if they have any interest? We would really love it if people participate in our research studies. Obviously, there is no pressure in any sense to participate, but if people are interested, that's great. We in some of our studies, we have pretty specific criteria for entrance into the study. One of the questions that we got ahead of time here was, saying that, do we treat PANS? We seem to be only sort of focused on PANDAS. And the reason for that, so we do treat PANS, but the reason that we focus on PANDAS in our research studies is that it's easier for us to understand when someone's symptoms started when they had a strep infection. And we can test for a strep infection. We have a medical record that shows that they had a strep infection. For any other types of infections, it becomes much, much harder for us to nail the infection down. That's why we focus on PANDAS for the most part. But we have a number of different, we're going to be sending out another internet survey on the effect of COVID on families with PANS and PANDAS and OCD. So we'd love it if people are interested in that. Everybody who is involved here today will get sort of a follow-up email asking about, how they felt like today went, and if they would be interested in hearing more about our research studies. So you'll have an ability to in the next couple of days to be able to contact us or be contacted by us to find out if you'd like to participate, and we'd love it if you did. And the last thing is philanthropic support. So I know it sounds strange to say, we really rely on philanthropy from folks because our clinic, most psychiatry clinics actually function at a loss, and ours is not any different in that regard. And then for our research, we have been very fortunate to be supported by PANDAS Network, by PANDAS Physicians Network, by the International Obsessive Compulsive Disorder Foundation. And those things have everything, that we do on our end that I presented today has gotten its start from something like that or from philanthropy. And the reason being, unfortunately, is still, it's so hard for us to convince the National Institute of Mental Health right now to fund these different studies. Again, we're going to change that. But we just looked this statistic up recently. NIMH has put about $11 million in total towards PANDAS since 2007. It's just not very much money. So right now, if you are so motivated or have the capability to help us out with any sort of philanthropic support, we will put it towards our research. We'll put it towards treating kids with this disorder. And we really, really appreciate if people are able to do that. It means a lot. Other than that, I'm going to just quickly run over our funding and support because I want to leave time for questions. Again, PANDAS Network, Bending Minds Foundation has been incredibly helpful to us with funding as well. The International OCD Foundation, we have a few anonymous donors who I can't tell you how. I mean, we are here because of what they've done. And then we have just a ton of collaborators both at Mass General, in our PANDAS program. Again, Dan Geller. I couldn't do any of this stuff without Sarah or Saffron. With Dr. Pasternak too, is just an integral part. And then Mary Spencer, hopefully everybody has had a chance to meet Mary. She keeps everything running for our program as well, both on the clinic side and everything else. For MGH, our collaborators, again, a list of Molly. I didn't have a chance to talk about Lauren Breithoft, her research today, just a phenomenally interesting research she's doing on infections and eating disorders. So stay tuned for that. She's starting to work on PANDAS as well. It's going to be a really interesting couple of years in the next couple of years from her studies. And then finally, Jacob, Amanda, Marek, and Noreen are all helping for our various imaging projects. So with that, I'm going to stop here and leave. We've got at least 15 minutes for questions, and then we can hopefully run a little bit afterwards as well. But I really want to thank you for tuning in today. And I guess before we stop and take questions, also I want to say that we're going to do this again. So we're going to do this again in 2021, and maybe a few of these as well in 2021, because I think it is very hard for, I mean, I've got 2 young kids, as everybody heard my kid bang on the door. It's really hard to keep up with this stuff, right? So even if you're interested in it, it's hard to, you're not going to be. It's our job to sort of scour the research, and I think to transmit it to folks. So we'll keep doing that. Again, thank you, and then we'll take a break here for questions.
All right, great. Thank you so much, Dr. Williams, for that talk and all of that great information. And I am just overwhelmed by the great questions that we are getting from both before this, and then we've gotten a number of questions while you were talking as well. I've tried to answer some of them. I apologize that I should know as a neuropsychologist the limits of multitasking, so I'm sorry that I think I responded to 8 of you. But we've also tried to kind of pull together the questions that we've been asked to kind of bucket them to see if we can answer as many questions as we can in this short amount of time. And so some of the questions were in regards to different ways to know about our program. And I know, Dr. Williams, you had the link before. Also in the chat, we have a link to the website for our program in case you're interested in learning about what the research studies are. And it would be great if you all could complete the survey after you've watched the video, just to give us some feedback too. Because like Saffron said, we love the data, and we love knowing what you think and thinking about kind of next steps for maybe doing a webinar again. But to jump into these questions, so we've gotten a lot of questions about treatments, about antibiotics, IVIG, vitamins, therapy, tonsillectomy, diets. There's so many treatments that parents hear about. What is most useful in PANDAS, and what has evidence behind it?
Yeah, these are great questions. I think there's a difference between answering the question about what's useful and then what's the evidence for it right now. And that's the hardest thing for us, because there have been 2 controlled trials of IVIG, right? And by controlled, I mean you're blinded. We don't know what you're getting, and you don't know what you're getting. Those 2 have kind of shown conflicting results. For everything else, there have been a few controlled trials of antibiotics, and they haven't gone very well. One of them failed, and a few of them were just basically sort of underpowered. So when it comes to the evidence base of what the evidence shows, we don't have that much. We have our clinical intuition, right? So we have, okay, I've tried antibiotics in this kid, and it seems like it really works. We tried, ibuprofen or naproxen sodium, and it seems like it really works. We have a lot of that information. The reason we have to do studies for this, though, is that is the only way that we translate that finding to other physicians or to other treaters in a way that they can have faith in. Does that make sense? I mean, otherwise it becomes sort of like one person trying to convince another person. And what we need to do is convince with the data. And so it seems like sometimes, I tell people like, oh, hey, we're, and Sarah, obviously, this quite well, as Sarah's running this trial. We're doing a trial of an anti-inflammatory medication for PANDAS right now. And some of the other folks I talked to are like, well, don't you already know that works? And the answer is, well, we think it works. We need to show that it works in a way that other people say, okay, I'm comfortable using that. So it's not just me, it's not just someone else, it's someone who reads the study in anywhere else in the country or world and says, all right, I can follow what they did and I'm convinced enough from this data to be able to do it. So, so again, to answer the questions, I know that everybody wants to know it's sort of what works in PANDAS. And right now, what I would say is it's sort of the kitchen sink of trying a combination of we try antibiotics originally, right? We try anti-inflammatories. For some people, I really think that IVIG works. But again, and to go back to kind of the blood, the antibody, if we could separate people out and say, okay, we are 99% sure that we only enrolled kids with PANDAS in this trial, and now we want to try anti-inflammatories in that, or, then we'd have a much different understanding of what works or what doesn't work. And so I think that we're just at the beginning to be able to start some of those things now.
And that kind of leads into the second question, actually. This group of questions was around sort of how can an accurate diagnosis be made, if there are any markers or tests that are evidence-based or helpful. I know you already touched on it in the presentation, but it's a really important point.
So, so we talk a lot about the symptoms of PANDAS, right? So of OCD tics, but then also some of the kind of the additional symptoms of handwriting change, of aggression, of some of those things too, right? And that's because we think that when those things start in combination with sudden onset OCD, we think that those kids are more likely to have PANS or PANDAS, but we actually don't really know, right? Because urinary frequency or handwriting changes, those are not unique and only seen in PANDAS. They're seen in a bunch of other conditions. We just think that it's sort of the entire thing together helps us make the diagnosis. But the real question really is how accurate are we? And I would love to be able to, so, and along with that, how accurate are we and how prevalent is this disorder? If OCD is 2% of the population of the world, which is amazing, but it is, what percentage of those people actually have PANS or PANDAS? And we can't answer any of that right now. We can't answer how accurate we are. And we can't answer how prevalent it is. I think until we really know, we have a gold standard, right? And the gold standard for us, I think, comes down to an autoimmune antibody. The Cunningham panel, I think, right now, I want to see more data on how it works or how sort of, how it differentiates between kids with OCD. And by the same token, I mean, we can apply that same sort of criticism to the work that we've done or that we've done in collaboration with Yale, where it's like, okay, we need to see how does this replicate? Is it present only in PANDAS or is it present in PANS as well? And the third question that's kind of the kicker that it seems, would be a cruel thing in the end if it didn't turn out this way, but is that antibody, is it just a red herring or is it actually causing the symptoms? And we need to answer that in a better way as well. So there's a lot of work to be done there, but now we finally kind of have a foothold that I think that we didn't for a long time.
Right. And this next question is, I think, one that a lot of families would be interested in because a lot of the kids that we see with PANS and PANDAS have siblings. And so this next question is, does PANS PANDAS run in families? Yeah. Is there a genetic risk for siblings? And how would PANDAS affect a sibling?
So I have certainly seen siblings that I believe have had it. I've seen folks where I felt like, okay, yes, this kid has PANDAS and the sibling has something, but it's a little bit different. So just because it's possibly an inflammatory condition, it doesn't mean that it can't also be genetic as well. In fact, there probably is likely a genetic component to it also. But again, we don't know what that genetic component is yet. So the Stanford group is far down the road on that. And if they haven't announced it yet, I think it probably will come out, in the next year, but they've really been looking into this. And I think that they could say that, yes, there is a risk for siblings because there probably is something genetic there, but they're going to be explaining that in the next couple of years. again, we still come back to kind of the thing of, if we don't have a testable thing, do we know that both siblings have it or not? So I would say that there probably is some risk there, but whether, what, it's hard, being a parent and being a parent of, you want specific answers to questions, right? I mean, I understand that for my kids too. It's sort of like, okay, so if one kid has this, are you twice as likely to have it? Is it 5 times more likely? And we just are not there yet. But it's all out there in the future. But right now we have a hard time with those questions.
Mm-hmm. And like you said, we're kind of working on this piece too. And, I apologize that we were saying earlier that some of our patients we've had answer so many questions, in part, this is why we ask so many questions too about family history, right? Of not just about PANS, PANDAS in the family, but also other types of inflammatory conditions. So thank you to all of you for your patience in filling out all of those questionnaires of extensive family history and things you might not even have heard of before.
Yeah.
Yeah, and sort of going on from that point about all the data we collect, some of that relates to the next question that we had about is PANDAS and PANS something that children will grow out of over time, and what are the long-term prospects
Great
for children with this diagnosis?
Yeah. So I think the beginning of that question is looking at tic disorders, which again, a different thing from PANS and PANDAS. But if you have a tic disorder, Tourette's, motor tic, vocal tic, you are very likely to outgrow that as you age. Why? We have no idea, right? But the vast majority of the tics either go away completely or they get much better as someone ages. I think I would go, and I've told a lot of people this in clinic as well. I really think that this disorder, for the most part, is limited to children, meaning that it does get better as they get older. I think that a lot of that, the caveat to that is that it probably gets better with treatment and getting older. So I don't know if just age is enough to do it. To come back to what Sarah was just saying too about why we track all these symptoms, the other thing too that we, the reason we do this is that, so right now, I would say the vast majority of our patients are between the ages of 6 and 12. And after that, a lot of people don't need to come back and see us because they're doing much better, right? But if that is the case, if we really see a drop off in severity or everything else, we'll be able to show that if we collect that data, right? And I know that that's a no-brainer, but it's hard for clinics to do that, and we're able to do that now. So I think we'll be able to answer those questions later on. I do think it gets better with age. We need to show evidence of that, and we'll be there soon, hopefully.
And Kyle, I know earlier you had mentioned the COVID vaccine that might be coming out, and it sounded like from what you were saying that it's something that we don't necessarily have evidence on, how kids with PANS, PANDAS respond to the vaccine, because we don't even have evidence yet on how the vaccine works in kids.
Yeah.
But if you would just kind of clarify your recommendations at this point for both the COVID vaccine and also vaccines in general, including the flu vaccine, which is really relevant right now.
Yeah. So we always, unless there's a reason of allergy or things like that, I think that across the board, we are telling people to get vaccinated for if it's meningitis or flu, there's, I think that there are very few instances where I'd recommend against getting vaccinated because, but that doesn't, people say have people had the flu vaccine and had a reaction before? Absolutely. We have seen people have a reaction of symptoms to the vaccine. The caveat to that is that have we seen people actually then get the flu? They didn't get vaccinated, they got the flu, and yes, their symptoms were terrible too. So it's sort of between, you're kind of choosing between the lesser of two evils. But I do think that on balance, the people who have gotten the vaccine do better than the people who actually get the flu. And that doesn't mean that you're absolutely likely to get the flu. The majority of the so 2 points, we don't see that everybody gets a bump in symptoms with vaccination, but some people do, but it's usually pretty short-lived. So overall, I think that the pros and cons and the health benefits of the vaccine are far outweigh it. And I think with COVID, Sarah, Saffron, and Michael, everybody knows this very well. My wife just had COVID, and in the past week has been really hard. Everybody's fine now, but I would not mess around with it. You know, I'm sure you don't need me to tell you that, but yeah, so I would say for the kids too, that PANDAS would not be a reason to avoid getting vaccinated for COVID.
Mhm.
Yeah, another group of questions, we had a lot of questions on this point, was what is the relationship between PANS and PANDAS and other psychiatric conditions? And you mentioned this a little before, but things like autism, OCD, ADHD, depression.
Yep. So that's a great question. And the question is, are they linked in some sort of mechanism, or does one cause the other? The reason I'm saying that is, so I have certainly seen kids with autism who develop PANS or PANDAS, hands down. But that doesn't mean that, you know, all of autism is caused from infections or inflammation or things like that. But it's, for me, autism is not a rule out for PANS and PANDAS. How they're connected, I have no idea. Just to say that, you know, I think the most that I can say right now is that one doesn't preclude the other or mean that you can't have the other. But it's a little bit different for things like ADHD. So, you know, we see a ton of kids with ADHD, and I don't know if it's that those kids they developed ADHD after PANDAS or because of PANDAS, or they were sort of, had it in the mix to get ADHD anyway. But certainly I would say, I don't know, 30% of the time we'll be treating someone for PANDAS and they will really improve. Their OCD symptoms will improve. And then a few months later, it's like, oh, we were focused on the OCD so much for such a long time that we had no idea that actually homework is very difficult for a kid now, you know, or the sustained attention piece is really hard. And so then we get back involved again with some ADHD treatment. This underscores, I think, the importance of neuropsych testing. But I guess I would say that the disorders are linked, but we don't know how they're linked, except that we see ADHD probably the most frequently. Depression, it's hard to tell. You know, I think certainly being anxious for a long period of time and having OCD is a setup, as a cause for depression for kids. You know, but if they're linked in another way, it's hard to answer at this point.
Yeah, and that's another reason why we ask for all this data. And so when patients come in for follow-ups, we are also tracking symptoms of other conditions as well, like depressive symptoms, OCD symptoms. So thank you to everyone who has been filling in this data. It's really, really important.
Yep.
And Dr. Williams, I know, we're up on the hour now, and we've just gotten such a wealth of questions, but just as kind of a last one that kind of pulls together a number of ones that we've gotten, what can parents do to help?
Yeah. So I think that what parents can do to help. So I honestly, the biggest thing is, is taking care of yourself, is honestly having hope that this is going to get better. Because, you know, Sarah and Saffron, I know you guys have sat in on so many of these evaluations with me. It is so profoundly difficult in the first couple months when this disorder starts. You know, the families are having so much difficulty, and the kids have changed a lot from where they were. And then this, kind of feeling sneaks in about, is the rest of our kid's life going to be this way? Is the rest of, is this a permanent change now? Right. And it's a really hard place for people to be for a while. So I would say hanging on to hope about your kid getting better, right? Because the vast majority do. I can't say that all of them do. The vast majority, we find something to get them better. And then when that happens, if you want to get involved, contact us. We're happy to, originally, if your kid is having difficulty, having them in a research study is very helpful to us to understand how we help them and how we help other kids as well. So I would say kind of staying involved with our program is great for us and hopefully for the parents as well. We would really like to have more programming on like parental support groups and sort of, support groups for kids in the future if we could. But everything is, everything comes down to time and money. And so I would say that, again, supporting kind of yourself originally, your kid next, not that you wouldn't do that, but just hanging in there. and then reaching out to us and seeing, if you have time or if you have interest in being involved in our research studies, or again with looking at we exist only, and it's a tenuous place sometimes to be, but we exist only because of philanthropy right now. And so hopefully that will change at some point in the future, but it really allows us to build out more programming and to help to continue to do the type of research that we want to do. So that's also very helpful as far as being involved.
Great, thanks. And so I think people have been asking about the links to and kind of what that contact information is. It should still be in the chat, I think, to be able to have the link to our program and to fill out the survey afterwards. People have also asked about, can they get a copy of the recording, or how can other people watch it? I believe that you will automatically get an email when the recording is kind of finalized and sent out that has a copy of the recording, as well as a follow-up email about potentially filling out that survey to give us information in case we do another one of these, and to help us kind of plan and see what you need as well. So that, yes, so those are just posted again in the chat. So
and feel free to share the recording as well. I saw some questions about that, but yeah, you can share it. We'll have it on a few platforms, I think.
Yeah. Yep. We are really, I think, going to build out our website. We've been, and just to give everybody kind of a quick, we have been, I think, I know some people have heard me tell the story before. When we turned the phones on for our clinic on the first day, we had 150 calls in 2 days. So we had a wait list of 80 people in the first 2 days of our program. And that was 6 years ago. And we've seen in the last 6 years, we've seen over 1,000 kids. And one of the things I think that is hard is when people call and they hear that it's going to be a 6-month wait or a 1-year wait. And we feel terrible about that. But we, collectively are managing so much. We want to really fulfill both these missions of treating as many kids as we can, but learning from this and making sure that, in 5 years, you don't have to come to a specialty PANDAS center, right? You could go to, and there aren't that many specialty OCD centers for kids either, so that's a bummer as well. We need to change that. But you don't have to go, it can be accepted and recognized, and we can accept what the treatment is in a way that you don't have to wait to come to our program. You could go somewhere else, right? And you don't have to wait to come to our program now. I'm not saying that we're the only ones who treat this by any means, but there aren't that many places to go. And so we really, I think, try to judiciously divide our time between research and clinical care, and it leaves us less time for clinical care, and that is hard for all of us. But we feel like if we didn't do the research, it wouldn't get done. And we have this resource in a way that other folks don't, as far as having the expertise and having the technical know-how at Mass General and having the throughput of patients that we really wanted to both to grow that, but to continue to have that be part of our mission. Again, so check back on our website. We are gonna to build that out more, I think, in the next few months. We will do another one of these. It would be great. I think it would be really interesting to have, again, just like it's been a discussion tonight, but to have, Dan Geller and, Mark and other folks involved in our program as well to be able to answer questions. And we should probably do one that's just questions too, to be honest. So check back. We'll try to stay more active in this, research and in email contact and our website. But I think just stay in touch, stay healthy, and I hope that everybody is not, I know everybody's affected by this, but hopefully everybody, we can all make it through and stay healthy. In the meantime, this can't go on forever, right? I feel like that's the 2020 saying, right? Is that this can't go on forever, but it's true. We'll get back to a more normal footing soon. So thank you again for spending this time and being here with us tonight, and check in again soon.
Thank you.
I'm sorry, and a huge thank you to Michael Johnson and to the development team and to everybody that made this possible tonight. So thank you for sticking with us and setting this up, and check back.